Sure. Thank you, Neha ji. Thank you, Hindi team. Thank you, Deepamala ji. Now we are moving to the English session. Today is our 2177th day of continuous webinar. Thank you all the participants for joining with us. Before beginning the session, we'll have a silent prayer. Good evening and welcome everyone for today's session. Today is our 2177th day of continuous webinar. So we are continuously doing this webinar without any break and without any leave. Thank you all the participants and thank you all the members of IFPH and the participants and the faculties for joining with us. And today's our guest is Dr. JINESH MEHTA. He is BHMS and MD scholar in the Department of Organon of Medicine in RHMC, Parul University, Gujarat. So, Doctor, you are most welcome to IFPH webinar. Dr. JINESH, you are welcome. Please. You are the co-host, so you can unmute yourself. Dr. JINESH, can you hear me? Dr. JINESH? Dr. JINESH? I think Dr. JINESH is not. What happened? Doctor, please speak. I think Dr. JINESH is not hearing anything. Doctor?
Maybe
Yeah. Please
problem.
talk. Doctor? Can you hear me?
Let me go. His audio is not connected.
Is it?
Yes, I shall call him now.
Okay.
You may talk in between something.
Okay. So it will take time. Dr. Deepamala, I'm seeing you after a long time. So I think all of the participants, you subscribed our chat. Yeah, we can hear your sound here.
I can share my slide.
Yeah, we can hear you, but I think in the computer, your audio is mute, I think. Yeah, your screen sharing is visible. Can you hear now, Dr. JINESH?
Yes, he may be.
Can you hear me?
Please wait. Let's do one thing. Let's just a lot of.
I think Dr. Danish, I think he muted the sound from his computer, I think. Before it was happened to me also.
I shall call him again.
Okay.
Doctor, hello. Doctor, can you?
Hello, sir. We can see you and we can see your again. So I can start the presentation. Yes, we can. You can start the presentation. Oh, okay. Okay. Okay, you may talk. Hello and welcome to all of you in today's presentation. Myself, Dr. JINESH MEHTA, teaching scholar Part 2, Department of Organon of Medicine and Homeopathic Philosophy, IFMC Parul University. My topic for today's presentation is about the susceptibility in the clinical practice, from the assessment to the posology and the remedy response of case-based approach.
Dr.
These are the
JINESH.
objectives of my today's presentation. First, I will briefly discuss about the susceptibility.
But now also your sound is not clear, doctor.
Then between the susceptibility, sensitivity, reactivity, the common things and the difference. Then the criteria for the assessment of the susceptibility in the clinical practice. Then the planning and the programming of the treatment of the case by the potency selection and repetition of a dose, and the remedy response evaluation or the assessment are the follow-up criteria. So the first two objectives I will try to discuss briefly initially, and the third, fourth, and fifth objective I will try to discuss along with the case. So it will save the time. So what is susceptibility? It's a general quality capability of the living organism of receiving the impression
Doctor,
and
now
power to
also
react to the stimuli
your
in
voice
the
is
environment at the level of the cells and the tissue. There are two things in the world, living and the non-living, and the susceptibility helps to differentiate between the living and the non-living. So in the living organism, in the life, there are different phenomena of our life, like the adaptation, the nutrition, metabolism. All these phenomena of our life in a different forms and different expressions is because of the susceptibility. Susceptibility generally expressed at the level of the cells and the tissues. The cells is the basic structural and the functional unit of all the living organisms. And the susceptibility is determined by the genetic code. And it is responsible for the peculiar form of the reactivity which is exhibited by the cell towards the stimulus. So the susceptibility of a cell is the fundamental expression of a gene which is responsible for all the expressions of the system. Susceptibility varies according to a time in the same individual at different phases of our life, also different in different individuals. There are types of susceptibility in normal, abnormal, and the distal. Distal means severe. In abnormal, there are two types, high and the low. And between them, there is a moderate susceptibility. We can say about moderate to high, moderate to low as well. So, normal, abnormal, and the distal. As a living organism in daily life, we come in the contact with a different type of the stimulus, mainly the adverse environmental stimulus. If we have the normal susceptibility, what will happen? The psychoneuroendocrine axis and the reticuloendothelial system come into the power to protect the organism. And there is the one power, there is the power of adaptation. If we have a normal susceptibility, and because of the power of adaptation, the susceptibility will spread, but it will be within the elastic limit. So the power of adaptation will be there, and there will be the balance, and there will be the normal type of the reaction, and the control will be there among the system, and that is the health. When the power of adaptation starts losing, that will lead to the abnormal form of the reaction, that will lead to the loss of the control, and the balance will be lost, and that results into the state of a disease. So the health means a normal susceptibility, and there will be no derangement of the vital force, so there will be no signs and the symptoms because of the power of adaptation. And when the power of adaptation starts losing, there will be the resulting to the abnormal form of susceptibility, derangement of the vital force, and that leads to the signs and the symptoms. So the traveling from the health to disease is the traveling from normal susceptibility to the morbid susceptibility. So patients express everything in the form of the signs and the symptoms. So how we can judge the susceptibility? There are two aspects. The first one is availability of the characteristic signs and symptoms. And the second one, types of the changes at the level of the cells and the tissues. Now, what is a cure? Cure means the restoration from morbid susceptibility to the normal susceptibility. Which are the things which are necessary for the cure? The first one, that is the stimulus. Patient express everything in the form of the signs and symptoms, and the totality of the symptoms is the main thing which is responsible and which helps to find the stimulus. During the case taking, after forming the totality, we come to the different group of the medicines, among 5, 6, 7 of the medicines, which show some similarity. But the degree of the susceptibility to the medicine depends upon the degree of the symptom similarity. Highest degree of the similarity, higher the susceptibility, and higher will be the potency. So the first thing is important for the cure is the minimum. Along with that, the proper potency and the dose also required for the cure, and the proper assessment of the follow-up also is necessary for the cure to restore the susceptibility. Another important aspect is the sensitivity. What is sensitivity? It is an inherent capacity of all the living organisms to react to the stimulus into the environment at the level of the mind and the nerves. Susceptibility expressed at the level of the cells and the tissue, where sensitivity expressed at the level of the mind and the nerve. How it is assessed? Sensitivity assessed by intensity and the presence of a characteristic at both the levels. At the mental level, at the nervous system, at the mental and physical level. And this can also be studied from the patient's tendency to react at both mental level as well as the physical level to the distress which is produced by the illness. So by taking the history, we can come to know the tendencies, how the patient reacts to the different phases of life towards the stimulus. Also, data can also be obtained through the study of the intensity of the symptoms, Along with that, understanding of the mental state and the mental symptoms and the physical examination findings, also we can assess the sensitivity. There are different degrees of the sensitivity, like the high sensitivity, moderate sensitivity, and the low sensitivity. High sensitivity defines by high amount of the reactivity and the high amount of the characteristics of the signs and symptoms at the level of the mind and the nerve is present. It shows a high amount of the sensitivity that helps to reach the high amount of the potency and infrequent repetition. Moderate susceptibility means there will be a moderate amount, moderate to low level of the reactivity, and there will be the moderate amount of characteristics at the level of the mind and the nerve, and the susceptibility will be, sensitivity will be moderate, and the potency will be medium potency, infrequent repetition, and the low sensitivity means there will be a low amount of reactivity at the level of the mind and the nerve. Characteristic will be very less, so the sensitivity will be low, the repetition will be the frequent. So in short, the sensitivity is the capacity to react to the stimuli at the level of the mind and the nerve. It is assessed by the intensity of the symptoms, mental state, and the mental symptoms and the physical findings, and that helps to selection of the potency and the frequency of a dose. Another aspect that is reactivity. It is one of the facets of the susceptibility, and how we can judge the reactivity by means of the effect. The evolution of the disease is also the content of a disease form that perceptible to the clinician that will help to judge the reactivity of the patient. If a form containing a cluster of the characteristics which appear very rapidly in the given case, it implies that the patient has a high state of a reactivity, and that leads to the high level of the reactivity, high potency, infrequent repetition. So reactivity is judged by effects and evolution of a disease form perceptible to the clinician, and the rapid emergence of the clusters of the characteristics which shows a high reactivity that helps to reach the high potency and infrequent repetition. This is the basic difference between the susceptibility and sensitivity. Susceptibility means the capacity of organism to affect it and response in the form of magnitude and intensity. Susceptibility expressed at the level of cells, tissues, and organs. Sensitivity, the name itself suggests the sense related to a spatial sense, nervous system, which reflects at the level of mind and the nerve, which shows the quality and individual character of a response. And the sensitivity and the reactivity, ability to receive and ability to perceive the stimulus, that is the sensitivity, and ability to respond and adapting towards the stimulus, that is the reactivity. Sensitivity will be the high, moderate, and the low, and the reactivity will be the high, moderate, and the low. According to that, the potency will be selected and the repetition will be done. Now this is a case presentation. I'm presenting a case. I took this case on 17th of November last year. A case of 22-year-old female, Hindu female, nationality Indian. She is residing in the Rajkot. She is unmarried and by diet she is vegetarian. There are 5 members in the family: parents, patient herself, and the paternal grandfather and the grandmother. By study, the patient completed the BCom, and she don't want to study further, and she wants to do the fashion designing course, but the parents not agree with him, not agree with her, and they want that she should complete the MCom and they should go for a job and then also try for the competitive examination. But when I asked about occupation, first she said that I'm unemployed right now, but I tried many things in the past and I want to do the many things, but I don't know what to do. This was the statement which was given by the patient at the time of the preliminary test. Each complaint of the patient, the first thing was she described the failure to travel, is not able to gain the weight since the age of the 6 years. The second complaint was irregular menses since the last 1 year. The main patient went to the gynecologist and for this complaint, and the gynecologist advised for the thyroid function test, and the report was already done by the patient, and the report was normal. And what the gynecologist said that because of the stress, all the things are happening. So irregular menses was one of the problems. Because of the stress, there will be the profuse menses and the prolonged painful menses, and the dysmenorrhea relieved by the local heat before the 3 mark symptom. Another complaint, recurrent gas, acidity, and the indigestion since the school age, and there is an intolerance of the milk 3 months, and because of the stress, all the GIT complaints were there. And since last 15 days, having a complaint of fissure in the ano, and the patient went for the proctologist or surgeon, and they give some local application, and there was slight amelioration was there. This is the ODP of the patient. Patient was asymptomatic before the 6 years of age. He was very healthy, but during the age of the 6 years, there was a lot of family conflict between the parents, also between the parents and the paternal grandfather. And since then, he is not able to gain the weight. And since then, the DID complaint, especially with gas, acidity, flatulence, gastric headache, disturbed sleep, will start developing. Milk was intolerance, and because of the milk, a lot of blood troubles were there. Also, having a lot of episodes, many episodes of diarrhea because of the eating the fruit and during the stressful conditions. Allopathic treatment was taken. Patient went to MD physician, MBBS doctor also, but they give symptomatic treatment and was a relief. But again, the complaints start developing. Ayurvedic treatment was also being taken, but relief was slight and the symptoms again reappearing again and again. Before 1 year, menstrual irregularities were there, and the gynec opinion just taken, and the advice for thyroid report was normal. Treatment right now going on is just multivitamin, and some before the 8 months suffer from the dengue, hospitalized, and since then the HB is 10.5, and other reports are normal. And last 15 days, the Fisher MD no relief by the local application, which was given by the professor. Past history during the childhood, recurrent GI complaints, and unable to travel since into the 6 years. Diarrhea many a times because of the fruits and because of the stressful condition. Tonsillitis during the childhood, repeated respiratory infection during the childhood, and the menstrual irregularities since last 1 year, and the dengue before the 8 months, hospitalized, treatment was taken, but since then, the hemoglobin is low. That was the last thing. And the family history, the father having the hypertension, mother having the allergic rhinitis, maternal grandmother, pulmonary tuberculosis, and the paternal grandfather, type 2 diabetes mellitus. So if you see the miasmatic analysis, psychotubercular miasm, which is going on in the family. That was the general examination. General condition, okay, very conscious, very cooperative, and oriented. The face was very lean, thin, debilitated, and emaciated kind of the person. Weight was normal. When the weight was just 48. Height was okay, but weight was just 48, and BMI was 18.75. So very close to the 18 because of borderline for the low weight. And the examination tellurely was there. Other examination findings like icteros, cyanosis, clubbing, nothing was there. Lymphadenopathy, pedal edema, all were absent. Skin was generally dry, but face was oily. And nails were also normal. Vitals, the temperature was 98.1, blood pressure 110/70, pulse were 82, and the pressure was 99. So moderate vitality was there. Systemic examination, everything was normal. Even abdominal examination was also normal. Soft abdomen, non-tender, no organomegaly was there. CVS, respiratory, CNS, all the examinations were systems were normal. These were the reports which were done before the consultation. Patient already done this report. Hemoglobin was 10.8. The profile was, you can see after the dengue, this profile was developed. Other reports were normal. Liver function normal, thyroid function normal, renal function normal, urine routine normal. ESR slightly raised to 22. USG abdomen was also normal. This is the physical general. The appetite increased slightly. Great hunger, the +2 intensity was there. Also increased for very small quantity, not large quantity. Craving for the teeth +3, and the sour thing just +1. Aversion to fruits were there +2, and the intolerance to milk was +3. Thermal state was C3H2, means the more towards the T than both. Perspiration were marked perspiration on the trunk. These weak and debilitated emaciated person, menstrual history, menarche was at the time at 14 years of age. Cycle right now is irregular since last 1 year, 34 to 35 days of the cycle, duration 4 to 5 days. Clots present, but intensity +1. Before menses, pelvic pain is there and the backache is there, +2. During the menses, there is dysmenorrhea +3, which is relieved by the local heat. And the leukorrhea is there, milky, worse in the morning, but intensity +2. Last menstrual period was at 30th of October 2025. Stool once in a day, semi-solid, but sometimes, many times, diarrhea is there because of the fluid and because of the stress. Urine was normal. Sleep was usually good 6 to 7 hours, but because of the stressful condition, emotional conflict, many a times disturbed sleep is there. Dreams, sometimes because of the emotional conflict, dreams of accident, of injury, but intensity was not so good. I just mark 1+ for this dream. Now the life phase. The life phase is very important. There are two types of study in the life phase: longitudinal study and the cross-sectional study. Longitudinal study, which is analysis of the successive events through all the phase of a life, which gives an idea about the person's evolution through the different crossroads of the life, different phases of a life. And the cross-sectional study, a study across the event, it helps to understand the details and dynamics of this evolution. And when we study the life phase, all the successive events, all the phases of a life, it will help to assess the susceptibility and the sensitivity at different phases of our life. So life phase was very long. First, I took history from the patient's mother, and then I took history from the parent. It was a very long, so I just tried to sort it out and just prepare a brief life phase, so it will be very easy to understand, and we'll be able to get the different characteristics of the patient. During the early childhood, the situation was there. Both the parents, father and the mother, were working, and the patient was there with the paternal grandfather and the grandmother. Security was there at the home, but a lot of pampering was done from the family side. So patient was quite healthy, comparatively hefty child during the first 6 years of the life. Parents were working, they were affectionate towards the heart, and pampering was the key feature, but the security was there. And she enjoys the living and with her mother. Whenever she gets an emotional disturbance, sometimes feels alone, and she always wants her mother to be there with her. And some emerging traits such as affection, sensitiveness, pampering, strong attachment to the mother, difficulty in tolerating the emotional disturbances. These are some things I took from the life phase of the early child. Then around the 5 to 8 years, the physical changes start developing. As I just described, at the age of the 6 years, there was some family conflict between the parents, also between the mother and the paternal grandfather regarding some financial issues were there, and some social issues were there. Because of that, since the age of that, the patient was quite sensitive to this issue, emotionally very disturbed, and since then, difficulty in the gaining the weight was there. She experienced a recurrent minor infection and was considered physically delicate. Whenever she becomes ill, she becomes more emotional and wanted her mother to be there with her. And this was the characteristic pattern. The physical illness started developing, emotional vulnerability, and the clinging to the mother, which were the key events between the 5 to 8 years. School period, the patient was quite confident, but the sensitiveness was quite high. During the primary school, she was very talkative, she was quite active, interested in many activities like the drawing, like music, learning new things, going out, meeting the new friends, selecting friends, etc. She performed reasonably well academically as well. However, whenever the teachers start criticize, or the friends or the group circles, the students of the school criticize, it affects deeply. And even the ordinary matters also start affecting quite deeply. So sensitivity was quite high during that period. And also the relatives, and when they start criticize about the weight or about the health issues, she was not able to tolerate many a times, and this was affected her deeply. So she developed a high amount of the sensitivity, and adolescence, the beginning of the self-doubt was there. During adolescence, during the secondary school, she becomes comparing herself with the other students. Also become increasingly concerned about the academic performance. So comparison was there between her and between the other students as well, in terms of the performance, in terms of appearance, in terms of the weight, and all other things. Start comparing the things. And when relative commented her for fitness and advice, give some advice regarding the diet, she felt quite hurt and sometimes becomes quite angry. Externally, she could answer back, but internally, she felt very insecure. That's what the feeling was there. At higher education, when after the school, she entered into college, but it was not the college what she wanted to go. It was the college which was chosen by the parents. Because of that, she was quite disturbed. But she was very enthusiastic initially. After entering into the new environment, however, the progressing faster than she thinks that other students are progressing more faster than her. So still comparison was there. She became quite confused about what actually wanted to do. She changed a lot of hobbies, a lot of interests, a lot of activities like computer related work, creative work, some freelance work, but not able to satisfy. She don't know what she wants to do. And she would become excited about the start something new, excited, but again suddenly withdraw and change the decision. The family also gives some idea, gives encourage her to decide something upon the career, and the feeling was there. I don't know what I actually want. During the college life, the most of heart was there. She makes a lot of friends and she comes in the contact with emotionally with some different friends as well. But she likes one individual, but the parents are not ready for the marriage. So she, because of relationship, she becomes quite disappointed and cried frequently and took considerable time to recover. She felt she would not be able to manage without the emotional support. And later on, she becomes more selective about the friends. She preferred having only one or two friends. Initially, she was having a lot of friends, but after this incident, only one or two close friends were there and very sensitive. Then the family conflict again, major emotional turning point. During the later part of the college, huge family conflict occurred between the parents and the paternal grandfather, and some issues of the separation will start building up. And the things is going on her mind, what will happen to the everyone? She becomes quite anxious about the possibility of the separation and the family breakdown. And she becomes experiencing the complaint, physical complaint, like Mr. Snake, repeated thoughts, striking dreams were there, anxiety is there, gastric complaints were there. The dreams repeatedly were there, but intensity was not so high, like separations or accidents, water, injury. Then the beginning of a career, a fear of failure was there. After completing the college, he got some opportunities for the employment, and the problem was there at home, the security was there. And whenever she got out of the home, the security was not there. She always feels insecure. Yes, she feels that she had the necessary skills. She became frightened about the independently and being judged. She sometimes rejected the opportunities because of lack of confidence and the feeling of the insecurity. And when she encountered a criticism or uncomfortable work situation, she feels helpless and rather than the confrontation. She describes as an experience I couldn't fight the situation. That was the last part, the search for direction. Because she was uncertain about the career, she started exploring the different activities like drafting work, singing, music-related activities, guitar, creative projects, but not able to stick to a particular hobby because of the dissatisfaction, because of the insecurity. The diagnosis was a complex, was not a fixed diagnosis. Chronic multi-system clinical picture is characterized by underweight and overweight gain, with anemia, with menstrual irregularities, with dysmenorrhea, and fissure in anal is a psychosomatic component. And according to Hahnemannian classification of the disease, true natural chronic miasmatic disease. Enhances the evolution according to Kent's approach. Mental general, emotionally very sensitive, 3 marks. Want of confidence was there, +3. Anxiety about the future, anxiety about the health, +3. Sensitive to criticism, +3. Weeping, consolation, aggravate, +3. Elements of the grief, +3. Desire for a company, +3. Dissatisfaction, +3. Need for a security, +3. A changeability, +3. Dependency, need support, +3. Fear of a darkness, fear of a ghost, and hearing bad news. The key issue was there, the security and the insecurity. At home, she feels secure. When she goes out, feeling of insecurity and disappointment. The physical general, appetite increase, weight hunger +2, thoughts increase for a small quantity +2, craving for a cheese +3, craving for a sour +1, aversion to ice cream +3, aversion to fruits +2, intolerance to milk +2. Marked perspiration was there on the trunk +3, stool 1 time daily, semi-solid but many times diarrhea because of the fruit and because of the stress. Thermally, more towards the chili, sleep disturb because of the mental stress, and female complaints, irregular menses, pelvic pain 2 to 3 times before the menses, dysmenorrhea during the menses, relieved by local heat, and the milky leukorrhea, morning aggravation +2. And particular symptoms were there, like a dandruff with a white scale, intensity +1, recurrent mouth ulcers +1, fissure in ano relieved by the local application, and the indigestion acidity flatulence relieved by industry. Miasm, the fundamental miasm was psychotuberculosis, and dominant miasm is the tuberculosis. This was the totality. Dissatisfaction to everything +3, anxiety about the future, anxiety about the health +3, elements from the grief +3, low self-confidence +3, fear for darkness, fear for hearing bad news +3, sensitivity to judgment, sensitivity to criticism +3, desire for a company +3, weeping, consolation, aggravation +3, desire for a travel +3, emaciation +3, marked perspiration on the trunk, craving for the cheese +3, milk intolerance that leads to digestive issue, acidity, etc. Indigestion, flatulence relieved by lactation, and the menses irregular, dysmenorrhea relieved by the local food. This was the repertorization, and the 6 medicines were found. The first one was calcarea calf, second was lycopodium, third one was nux vomica, fourth one was phosphorus, and the pulsatilla and the calcarea force. The key points about the different medicines. For calcarea calf, the main issue is about the stability, about the security, and about the protection. Calcarea calf patients too weak to face the roughness of the outer world, and so they create the protective wall around the cell, and then they feel secure and they feel safe. They don't go out much and don't want any adventures in their life, and patients can rely completely on another person. These are the key important points of the calcarea. About the lycopodium, the key thing about the lycopodium is that they wants to grow bigger. Quite ambitious person, but there's a fear of undertaking the new challenges, and that leads to the lack of the self-confidence. And because of that, there's an anticipatory anxiety. The lycopodium patient is cowardness is there, inner cowardness, but externally they show a brave. This is a lycopodium. Another medicine there is netramune. There is a disappointment of a love. Chronic silent grief is there. It was not in repertorization, but the very similarity is there between the totality. So I just put this medicine in the list. Very emotional, aversion to the company, desire for a solitude, when hurt, and the great sadness and the thermally netramune is the hot. Nux vomica wants to get hit by hook and crook. This is the theme of the nux vomica. Very irritable person, very fastidious, explosive, expressive kind of the person, good amount of daring and violent behavior, but they are quite hopeful about the things, what they want to get. About the phosphorus, very sensitive person, they are little sympathetic. The phosphorus patients are sensitive to the feeling of the others, sensitive to sufferings of the others, wants to attend with the people, to the love, to the affection. And when they feel they not get enough attention, enough love, enough care, they feel quite insecure. And last one is the pulsatilla. The disposition is mild, gentle, weeping, and the disposition, yielding disposition, not able to face the challenges of the world. And the patient feels that I only survive if I will be very soft and gentle, soft and humble. The final medicine which I selected was a calcarea force, because there is a tubercular miasm is there, there is a debility is there at the physical level, but the hopeful is there. Patient is quite hopeful, patient is quite active. Constitution is lean, debilitated, emaciated, but patient is very sensitive, very fun-loving, and very changeable. They need security, but they can live a life alone as well. At home, they feel secure, but not much love. But for the love, he moves outward, but outward he feels insecure. Dissatisfaction and grief were there, and the pathology was defective nutrition, defective assimilation was also there, and the tubercular miasm. Because of this totality, I give medicine calcarea for. Now the third objective of my presentation about assessment criteria for the susceptibility. The first one is susceptibility of the tissue. The cell having a cell wall, and there are two powers are there, power of attraction and the power of selection. The cell got all the nutrition from the blood. They attract the nutrition, but the selectivity is there. Every cell of they will select whatever they want. So whenever any stimulus comes, and how the tissues will react, how the cells will react, that defines the susceptibility of tissues. And for this case, because of the complaints are there, the digestive issue is there, the menstrual irregularity is there, also the assimilation problem, and and the nutrition problem is there. The susceptibility is still moderate to the high. The reactivity is quite good. And so the potential will be medium to the high. Then comes the sensitivity. Sensitivity reflects at the level of the mind and the nerves. We see in the life space, every small amount of the issues, the patient becomes quite highly sensitive and highly reactive. So the sensitivity is quite high and the reactivity is quite high. The potency is high. The third one is about the suppression. A lot of suppressions were there. The last suppression was about the anal history in the anal by local application. The patient took some medicine for the GI complaint as well, some antacids and for some multivitamins were also continued. Suppression was there, but the susceptibility is quite moderate and the potency will be the medium. And the level of correspondence. The medicine is a constitutional. There are correspondence at the level of degree and at the level of the constitutional medicine. There are level and degree of the correspondence and the mental symptoms, mental state, and the disposure of the patient. At the physical level, physical symptoms, physical state, and the physical disposure. Disposure means on the characteristic of individual which remains throughout the life of the patient. A state defines a present condition. So at both the mental level as the physical level, at the constitutional medicine criteria 4, the level of correspondence in terms of degree, in terms of level is quite high. So susceptibility is quite high and the potency will be high. Age and the stage of a life. Age of the patient is 22 years of age. So the susceptibility is very good. And the stage of a life, patient completed the college and right now is in a phase of a career. He wants to wants to get the job, also try to do some different activities for the life stage. And so susceptibility is quite moderate to the high and the potency more medium to the high. Variations of the clinical form in the relation to the time. Susceptibility, considering the past history, the moderate to the high and the potency medium to the high potency. General vitality of the patient, the state of the vital signs and the functioning of the vital organs. The medium to low potency is there. The susceptibility is moderate susceptibility. The potency will be the medium. Characteristic signs and symptoms are there. At the mental level, there are qualified mentals are there. And so the characteristics are there. A lot of 3-mark symptoms are there. So the susceptibility will be high and the potency will be high. The temperament of the patient is quite a sensitive patient, quite nervous and very intellectual, very active person. So susceptibility is moderate to the high and the potency will be medium to the high potency. Habit, occupation, and the environment. The patient is living in an environment that home they feel quite secure, and when she goes out, but at home feels secure but not enough love, and when they go out, feels quite insecure. She gets love but feels insecure. And a lot of changeability is there in terms of the occupation is there and in terms of environment is there. So susceptibility is moderate to the high and the potential medium to the higher potential. Nature and the pace of a disease. The patient is suffering from the chronic disease. Pace is quite slow. Since the age of the 6 years, the problem of the not able to gain the weight is there. And since right now 22 years of age, so pace is quite slow. And the problem are more towards the functional than the structural. So the susceptibility moderate to the high and sensitivity also moderate to the high, potency medium to the high potency, and pathological changes more functional than the structural. So susceptibility medium to the high, potency will be there. And according to miasm, the fundamental miasm is a psychotubercular. So moderate to high susceptibility and the medium to high potency. But tubercular miasm is there. So the medicine should be repeated and the potency, high potency should be selected on the very cautiously. And dominant miasm also tubercular. So with moderate to high susceptibility and the medium to high potency, but with caution. Drugs utilized so far, a lot of drugs were utilized so far. So susceptibility is quite moderate and the medium potency selected. The final prescription was criteria for 1M because of the qualified mentals were there and the more functional than the structural pathology. So correspondence in terms of the mental and the physical level was quite high. So criteria for 1M was given with the Seclex 4/3 for 15 days. This was my another objective of presentation, the remedy response evaluation. So what is second prescription? It's the prescription that is given after the first one that is acted. So the first one must be acted and then the second prescription will come. How we can come to know the first prescription acted or not? These are some follow-up criteria are there, like the subjective distress, general, at the mental, physical level, disease activity and the new things. So whenever after giving the single mode, what we expect a sense of a well-being. Subjective distance should reduce, and the sense of well-being should be there. Which is a favorable response, and there are some 10 observations, like the second observation, third, fourth, 11, are the favorable remedy response. We can interpret this response and see the subjective distress come down, and the patient feels the sense of well-being. These are the favorable remedy response. And susceptibility starts restoring from the moderate to the normal. Another important criteria, general symptoms. If the general starts improving at the mental level and the physical level, if the favorable response is there, then the susceptibility starts restoring from moderate to the normal susceptibility. The response can be the abnormal as well. Like it can work, it can happen that no response will be there. And another activity, the disease activity, whether the medicine acted or not, whether medicine acted, then the disease starts, progress will be stopped. If medicine not acted, the disease will start continue moving from the functional to the structural. And the fourth one is a new symptom, which can be belongs to the disease, it can be belongs to the medicine as well. So appearance of a new symptom that suggests that medicinal aggravation, and appearance of a old symptom that might suggest a herring flow for cure. And the most important observations are the third observation, conflict aggravation, fourth, ideal remedy response, and 11th are the herring flow for cure. And according to that, the second prescription will be advised. These are the repetition criteria. The general rule for the repetition is that as soon as the adequate response is observed, the repetition should be stopped. And as long as the response continues, no repetition should be allowed. Duration of the response is not to be taken as an indication for the repetition. Many times, because of duration of the action, we might face a delay response, but so duration of the response should not be considered as a repetition indication. And the indication for the repetition is only that return of the original symptoms which had disappeared under the action of the remedy. When the case becomes canceled and the old general symptoms start reappearing, this is one of the criteria for the repetition. There are some modified rules for the repetition. For the acute case, frequent repetition indicated as the response obtained, the frequency of the repetition cut down progressively. In the chronic case, single dose generally advisable as a stimulation. Adequate response is obtained, then the further stimulation suspended. And before changing the potency, and the multiple dose stimulation should be tried. Otherwise, immediate aggravation will be there. These are the other criteria for the changing in the potency. Major Robert view is that either the inadequate relief or early cessation of good effect of a potency. There's a criteria for changing the potency, and when the potency exhausts its action and incapable of achieving the further improvement, that is one of the indications for the change in the potency. But Kent's concept is that the same potency should not be repeated for more than the two occasions. And when the highest potency in the scale has been reached, with the progressive increase in the potency, like 30, 200, 1M, 10M, 3M, etc., 50M, it is worth remembering that very often the sensitivity to low potency, like a 30, gets re-established. So after we reach to the peak of the potency, again we can start from the low potency because sensitivity is established. That was the follow-up of the patient. The first prescription was Calcidia for 1M for 15 days. After the 15 days, general well-being was there, slightly better feeling. Anxiety, emotional sensitivity was reduced. Sleep improving, appetite was good. GID complaints were less frequent, and the pressure in ano and dandruff also improved. No new complaints were there. Distress was decreasing, and the sense of well-being was increasing. So improvement, the interpretation was that the favorable remedy response interpretation is that the improvement is there. Do not repeat the medicine, continue with the medicine, you are settled for 15 days. Next follow-up on the 15th of December, appetite was quite good, energy level was quite high, weight started improving. When the patient came, the weight was 48 and 6.5 kg of increasing in the weight was there. Sleep was better, the gastric complaints like the gas and irritation were markedly reduced, mouth ulcer developed but was less intensity, and the menstrual symptoms beginning to improve. The last LMT was the 2nd of December 2025. And patient feels quite confident and less dependent. So improvement, interpretation of that improvement is continue this cycle. At the third follow-up at 29th of December, the improvement has stopped. No further gain in the general health. GIT symptoms were remained as it is, and the vitality was worsening, major worsening or improving, and no new symptoms were also there. So the thing what I suspect that might be the favorable response stop, but I still think that let's wait for another follow-up and let's see what happens. And so next follow-up at 12th of January, again no further improvement was there, no new complaints were there, but all complaints remain as it is. And the last menstrual period was the 3rd of January 2026. So I think the case becomes standstill and I think need for repetition was there. So again I repeat criteria for 1 and single dose and the cyclic 4/3 for the 15 days. Next follow-up on 10th of February 2026. Patient feels more confident and less dependent. Appetite was quite good. Weight was gained from 48.5 to 49.1 kg. There was improvement also in energy level. GI symptoms very minimal, like absent. Sleep improved. Menstrual cycle start becoming regular. Dysmenorrhea also reduced, and last menstrual period was 2nd of February 2026. And so the interpretation of that response good and the remedy is acting. So continue with the cyclic for 1 month. Next follow-up on the 9th of March 2026. Appetite was good, weight increasing to 49.6 kg. Energy level quite good, GI complaints were absent. Menstrual cycle start regulating. Last menstrual period was 3rd of March 2026. This measure also very less and no significant new symptoms were there, no anxiety, no fear. Patient feels quite lively. So the response was quite good. Interpretation is that the response is favorable. Medicine is acting. So continue with the cycle for another one. And 10th of the April, when patient came, there were a lot of liquor problems were there in the family, stress increasing, and because of the emotional upset, again the old symptoms start returning. But intensity was not as good, not as like previously. GI complaints were written mildly. Loose stool was for 3 times. Menstrual irregularities were written again, dysmenorrhea, but intensity was not as high as previously. LMP 4th of April 2026. General condition remains better than the baseline. No major deterioration of the vitality was there. And compared to the previous, the intensity was quite low. The weight increase was just 0.1 kg from 49.6 to 49.7. So I think the favorable response was not there. And so medicine potency should be raised. The criteria for 10 mg was given single dose and the cyclic 4/6 given 15 days. Next follow-up on 22nd of April. Appetite was good, weight gained significantly so from 49.7 to 50.6 kg. Energy level was quite good. GIT complaints were absent. No new symptoms were there. Emotionally quite stable and quite confident. So response was quite favorable. Interpretation is that medicine is acting favorably and should not disturb the action and continue with this cycle for another 1 month. Next follow-up on the 20th of May. Appetite was quite good. There was a mistake in the weight for 50.6. The weight was remained the same, 50.60 kg. Energy level was quite good. GIT complaint was absent. Last menstrual period was 2nd of the May 2026. This measure was quite there. No new symptoms. Interpretation, the response is quite good. Continue with the cycle. Again on 22nd of June, the follow-up was there. Appetite was quite good. Weight was 50.60 kg. Energy level was good. GI complaint was absent. Menstrual irregularity is almost gone. Menses become regular. This measure was quite less. LNP at 31st of May 2026. No new symptoms were there, and let us start preparing for the competitive examination. Means focus was there for area. Improvement was there. Interpretation means favorable response was continue with the cycle. And the last follow-up was at 23rd of July. Appetite was quite good. Weight increased from 50.60 to 51.4 kg. Energy level was quite good. GI complaints were absent. Menses were regular. Dysmenorrhea reduced. No new symptoms are there. Mentally quite stable and focused on the work with a confidence. So Response was quite good, favorable. Continue with the checklist for another month. Next month, and this month, I think patient will come for another follow-up. The follow-up is still continued. Case is still continued. This is the take-home message for my presentation. This was a statement I took from the Stuart Close under chapter Genius of Homeopathy under chapter Susceptibility, Reactivity, Immunity. That the kind and degree of the susceptibility depends upon largely on how the kind and degree of the susceptibility depends largely on how the case is handled by the physician. So it depends on the physician. The assessment of susceptibility depends upon the physician and they need observation, perception, and interpretation. Correct observation, correct perception, and correct interpretation that will help in the proper assessment of susceptibility, proper planning and programming of the treatment, and the proper assessment of the follow-up. And that is the reason why homeopathy is the science and the art. Science is all about the principles, all about the laws, what we study in the textbooks, and how to apply these principles and all the laws into the practice, that is the art. So assessment of susceptibility, assessment of the sensitivity is more towards the combination of the science and the art. And to fulfill the physician mission, that the first aphorism means mission of the physician to cure the sick. And the second aphorism, how the cure should be rapid, gentle, and permanent. And to get this rapid, gentle, permanent cure, not just a minimum, along with that, we need a proper potency, proper repetition, and the proper assessment of susceptibility sensitivity, along with that proper follow-up assessment that will help the rapid, gentle, permanent cure and the mission of the physician. So that was the last message. Minimum with proper potency and the proper dose. Appropriate repetition that will help the successful homeopathy management. So that is all about my presentation.
Thank you, doctor.
Over to you.
Thank you. Can you hear me now? Doctor, can you check the chat box? Any participants have any questions, means you can put the questions in the chat box. The presentation was nice, but there is a problem in your sound. It was very feeble. Doctor, can you type your number? Dr. Bindu Prasad, sir, do you want to ask anything? But it is not audible. I don't know what to do. Doctor, can you check the chat box? Dr. Danesh? Actually, we heard your class, but Doctor, please give your phone number here in the chat box. I think there is a problem in your computer. You have muted yourself. Let me call Dr. Danesh. I think he'll contact. Actually, Dr. Jidesh has taken a good class. The presentation slides, everything was perfect, but the voice was not clear. So, Dr. Bindu Prasad, sir, do you have anything to say?
Actually, madam, he is not able to listen what will.
Yeah, I don't know what happened.
Actually,
told,
what I am thinking, he is not also looking the chat box.
Yeah, that's the reason I'm. Doctor, can you check the chat box? Please. It's very difficult if it is.
Actually, he has collected or compiled the PPT in nice manner, but
Yeah,
we are not
exactly,
able to
exactly.
listen. So that is the problem. Dr. Jinesh, are you able to listen me? No.
No, he can't listen. Please check the chat box, doctor. Doctor? I don't
He is not
know.
listening what you are telling, madam.
Doctor, check the chat box. Please check the chat box. So, Dr. Danesh, can you please call Dr. Jidesh and tell him to start the sound button in his computer. I think he has closed the sound button. Anyway, it is the time to wind up the session. We are moving to the English session. Sorry. No, we are moving to the Malayalam session, and it is the end of the English session. So, Dr. Jitesh, it was so wonderful and nice class. You have given your PPT sharing and your case presentation was wonderful and excellent. But unfortunately, you cannot hear what I'm saying, and even you cannot respond to the things. So sorry for that. I don't know what happened. I think you have muted your computer. Even I was trying to tell you something through the chat box. Anyway, thank you so much. Thank you for your wonderful session. And now we are moving to the Malayalam session. Thank you, Dr. Jidesh.
Okay, there's an announcement for tomorrow.
Uh,
Tomorrow we will have a session from Dr. Halvi Gunwala, and she is MD scholar and the Department of Homeopathy Case Taking and Repertory, Ahmedabad Homeopathic Medical College, Paul University, and she will be talking about beyond the diagnosis, understanding the patient behind infertility. She is a very young, dynamic doctor who has so many successful stories about it. In her kitty with infertility and such cases. So hope all of you will join tomorrow. There will be a crashing session waiting for you, and her parents also are homeopathic doctors. So naturally, there will be be a big day is waiting for you. Thank you.
Thank you, Dr. Danesh. I'm inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, you're welcome, please. Dr. Danesh, you're the host now.
Yes, I have.
Okay, then. Bye.